Members, the question is the motion be agreed. The Honourable Peter Foster.
Thank you, Acting President. And I also too rise today to speak in the support of the motion moved by the Honourable Clara Andrich. And I thank her for moving this very important motion. And I want to add my name to this motion in commending the McGowan Labor Government for its commitment to delivering record mental health funding, particularly for both children and young people. I want to acknowledge the Honourable Clara Andrich's contribution and also the speakers who have spoken before me on this important motion. As I have said previously in this place, I believe mental health is everyone's business, and I'm glad that members on both sides of the House today are continuing this very important conversation by participating in this debate today. I have previously said in debate how I live daily with anxiety, and I know that many Western Australians do so as well, including young people and members of our LGBTIQA+ community. It is believed that as many as 1 in 5 Western Australians have a mental illness or a behavioural condition, with those aged between 15 to 24 years believed to have the highest proportion of mental illness and behavioural conditions. Numbers are estimated to be as high as 3 in every 10 young person. As has already been said, the 2022-2023 state budget was handed down earlier this year and contained a record $1.257 billion into mental health, alcohol and drug services right across Western Australia, which was an increase of 12.5% on the previous year's state budget. And I know that this investment was welcomed right across the sector. In the 2022-2023 state budget, there was $5.1 million allocated towards the mental health emergency telehealth service, which is operated by the WA Country Health Service. I know that this service is well utilised by regional residents in the electorate that I live. Additionally, the 2022-23 state budget included an additional allocation of $181 million to the Mental Health Commission for new and expanded mental health, alcohol and other drug services. And I want to spend a little bit of time for my contribution today talking about the Mental Health Commission. The Mental Health Commission, through that investment, purchases a number of services for the state from a range of service providers. And as a regionally based member, I want to focus my brief contribution just about one of those services. If you've never ever visited the Mental Health Commission website, I strongly encourage you to do so. It's quite a good resource of information. I played around with it yesterday. You can type in the region or your address and it brings up your local provider. So if in your electorate office you are dealing with someone that is experiencing a mental health concern, I strongly encourage your electorate office staff to bookmark that page because it's a really good source of information. For me and Tom Price, I could look where the local service providers are, both in Tom Price and in Newman and over in the coast in Karratha. The needs of the LGBTIQ+ youth in the regional WA are very complex. According to studies undertaken by the LGBTIQ+ Health Australia organisation, almost 25% of LGBTQIA+ young people aged between the ages of 14 and 25 live in regional WA. 25%, that's 1 in 4. The same study showed that almost 64% of LGBTQIA+ young people aged between 14 and 21 have been diagnosed with a mental health condition. 44.5% of those, 45% of those have reported to have received treatment. So there's a considerable number of LGBTQIA+ young people in regional WA who cannot access treatment. Compared to the general population, LGBTQIA+ young people are more likely to experience and be diagnosed with depression, with those LGBTI 6 times more likely, and those in the trans and gender diverse community 7 times more likely. Almost 50% of LGBTQIA+ young people aged between 14 and 21 report being diagnosed with depression. Almost 50% again diagnosed with anxiety. And an astounding 83% of those aged between the ages of 16 and 17 present high levels of psychological distress, with over half experiencing suicidal ideation. And I think that's really, really sad. Those statistics paint a very, very grim picture, especially for us in regional WA. Last Friday, 26th of August, it was Wear It Purple Day, which is why I'm wearing my badge here today, to show my support for Rainbow young people. Too many young people experience bullying and harassment. I was one of those in my younger days, from lack of acceptance about their sexuality or their gender identity. And I want to say to all rainbow young people that you are valued, you are accepted and you are loved.
Yeah.
In November last year, the Minister for Emergency Services, in his previous capacity as Minister for Mental Health, announced an investment of $500,000 to support LGBTIQA+ youth in regional Western Australia, funded through the Mental Health Commission for a 12-month pilot program. This program commenced in Geraldton, in Bunbury and in Kalgoorlie, and focusing on building health, inclusive and connected communities. The aim of the project is to provide direct support to young people, explore the broader issues that they face in regional communities, deliver workshops and deliver information to schools, educators, healthcare professionals, caregivers and parents. This project is being delivered by WAAC, formerly the WA AIDS Council, whose aim is to welcome and support people from all walks of life and aim to build healthy, inclusive and connected communities. I had the honour a few months ago in visiting WAAC's offices here in Perth, just down the road actually here in West Perth, and I had a meeting with the CEO Lisa Dobrin and her team, and they are doing fantastic work right across WA in tackling some of these really serious issues. We talked about the Freedom State program, which is what the $500,000 was allocated towards. Lisa told me that her team are working collaboratively on the ground with local groups, community members and agencies, and building referral pathways to other services to ensure that young people get the support they need. It was pleasing to discover this week that WAAC actually have had their pilot extended for a further 12 months, which is great. So now that this service will be continuing until June 2023. And they are expanding. Not only are they servicing Bunbury, Geraldton and Kalgoorlie, they're now moving into the southwest region, they're moving into Esperance, and they're also looking at moving into Carnarvon. And I've already had one initial meeting with our worker who's looking to build some connection in Carnarvon. In Bunbury and Kalgoorlie, they are co-located with Headspace. In Geraldton, they're co-located with a psychology service, and they work with a number of local organisations, including Out Southwest, Out Midwest, Pride Goldfields and Margie Pride. They also work with other organisations such as the Y, City of Bunbury, City of Greater Geraldton, City of Kalgoorlie Boulder, Mission Australia, Youth Focus, WAAC's, Graham's and many of the local schools in their catchment area. I just wanted to talk about a few, so these are a few of the comments made by staff who work for WAAC and deliver the Freedom State program. This is from a staff member in Bunbury. They write, "I've participated in youth events that provided some young people within the LGBTIQA+ community for the first positive representation of queer people they've ever seen in the region, showing them that people care and that times are changing. I've met a lot of wonderful young people who have entrusted me with some of their deepest and closest inner knowing about their gender journey, something that I hold very dear. A highlight for me was working with the Shire of Capel and receiving feedback from young people saying it was the first positive LGBTQIA+ event that they had ever seen. And another saying it was great to see that this will have a positive influence on school bullying, which was flagged as a razor issue. This was the story of another student at a local senior college who expressed their gratitude as they had had to move schools due to bullying. This is from a community development officer in Kalgoorlie. A key highlight for me was at a community parents and carer workshop. All the attendees were wanting so earnestly to know how to support their young person through their journey and experiences. Few attendees spoke about someone in their young person's life who was not supportive of them and making their life challenging. When discussing challenges their young person was facing, few people began to cry out of sadness and wanting their young person to be okay and not knowing what to do. I held spells for them in that moment and ensured that they were taking the correct steps to seek help and that would mean a lot to the young person and knowing that they are safe here now. Noting that I only have 20 seconds left, there's so much more to talk about on this topic. I do want to thank the McGowan Government for its record investment, especially this particular pilot program, the Freedom State program, which is giving real benefits and saving lives. to regional people. And I thank you for Honourable Clara Andrews for moving this motion and giving me the opportunity to speak.